Hello, everybody. My name is Jill Hartland, and we've been working on trying to get this Facebook Live for the last hour. So I'm so glad that you stuck with us if you're still with us. My name is Jill Hartland, as I mentioned, and I'm a director of new guest success here at the Hotze Health Wellness Center. And essentially, all that means is that as new guests come through our door, because we call our patients guest, because that's what you are. My role is to make sure that whatever regimen the provider and you discussed, you do great on, because your body is not my body. It's very unique. And it's antecedents leading up to this point. So I like to be able to pivot and pace with you and walk with you as you start turning your health around. And so I really get a front row seat in seeing you come in feeling your worst, and then watching your life, your relationships, your marriages, your kids, all of this start to transform. It's the best role and the best blessing. It's such a ministry and a passion of mine. And also, I will say that my passion is to keep people out of the hospital. So my career, just to give you a little bit of background about me, is I'm a career ICU nurse, mainly pediatrics, since 1996, if that helps you with my age. But I've been doing that most of my life, and then also doing some adult ICU as well, in the form of in the role of ECMO specialist. So I've seen what it's like to try to help people get well in an emergency, in a crisis. And it's not, even though it was great for me in that role, for you as patients and of the hospital system, it's not necessarily fun. It's very stressful. So my passion is to keep you out of that situation, and let's start looking at how we can help your health beforehand. So an ounce of prevention is worth a pound of cure, right? And that goes for not only how you're feeling, but I also think about your pocketbook as well. Like, everything is just so much better when you can take care of your health and make different choices ahead of time. And so let's see. And so I will say, back in 2020, how I ended up here back in 2020 to 2021, during the you know what was happening during those years. It was high stress, and I actually got very sick. All that stress and everything that was kind of going on during that time, as I was a manager there, I wasn't feeling great, and I decided to make a different choice for myself and start looking at how I can get my health back more naturally and holistic, and really start looking at the root causes, because now I'm in charge of my health. Like, I got to figure me out. Nobody else is responsible for me. And so I landed on the door at the Hotze Health Wellness Center, mainly because Dr. Hotze and I ran into each other. He's like, "You ready to work for me?" And I was like, "Yes." And so with that, you start to see how people are looking towards alternative ways of getting healthy, and trying to stay away from the healthcare that it is today, because the healthcare that it is today looks nothing of like the healthcare that it was 10, 15, 30 years ago. It's very different, and the care is very different as well. And so that's what I want to help you do. And so one of the things, so Sherry is also on this call. Sherry Allen is one of our wellness consultants, and she is one of three, Jen Hazenbank as well as Samantha Levine. And I would put them up against any traditional conventional doctor, because their knowledge is incredible, because they're looking at health in a different way. And so I learned so much from them, because and I'm still learning this new way of looking at health, and what everything all means. And so as far as like thyroid and hormones and nutrition, because I didn't learn all of this. So if you can pop in the chat, if I'm hoping that y'all are still here, so I might not see the chat, but I at least wanted to leave y'all the recording. But if you're live with me now, if you could pop into the chat. That's what I was going to say. Sherry is the one that mentioned that these are common questions that she hears from women that are calling her wanting help. So if you've ever heard, you don't need progesterone, you've had a hysterectomy, or you're in menopause, you don't need progesterone, much less or hormones. Give me a thumbs up in the chat if you've ever heard that. And what about if you've ever heard, breast cancer runs in your family, or you have a history of breast cancer? You should never take hormones. Give me a heart. It's not really a heart kind of a thing, but give me a heart. And then if you've ever heard your doctor say, you should never go on hormones. Give me a smiley face. So again, like these are 3 beliefs that I hear, or not even me, because I get on the back end after Sherry has, kind of educated, or Jen or Samantha has educated you a little bit more about what hormone therapy looks like when you're looking at it from a bioidentical hormone versus a synthetic hormone. So the first belief that I really want to unpack, at least in the time that we have, is to talk about progesterone and the uses of it when you don't have a uterus, or if you're not having menstrual cycles. Progesterone, like everything else in your body that your body creates and makes, it does so much more than the organ where it's produced in, right? So your progesterone made by your ovaries, and so, and if you had an oophorectomy or as well, and your body's no longer making hormones, it does not necessarily mean that your body doesn't need that thing. You think about if your pancreas isn't producing insulin, it doesn't mean that you don't need insulin in your body. Or if you had a thyroidectomy, it doesn't mean that you don't need thyroid hormone anymore. No, you have cell receptors on every one of your cells for particular hormones and nutrition and electrolytes and things like this. So your body still needs all of these things. Just because you cut something out, or because you're no longer going through having menstrual cycles, it doesn't mean all of a sudden you don't need that thing or that hormone. And progesterone does so much more than just helping you with pregnancy or your menstrual cycles, or helping with your uterus. It actually has like a calming effect. It actually calms your brain by working with the GABA neurotransmitters in your brain. So it actually has like a nice relaxing piece to your brain, helping you feel calm. It also helps you have a deep restorative sleep. Matter of fact, if you've ever been pregnant, you know that the first trimester, you're probably always with your head on your desk or just always wanting to sleep. There's a very real reason for that. Why you're so sleepy, and it's because your body is making 3 times the amount of progesterone in that first trimester to really thicken up that uterine lining to protect your pregnancy. It also helps strengthen bones by stimulating osteoblastic activity. And so if you've ever had osteopenia or osteoporosis, or the beginnings of bone breakdown, progesterone can actually be such a huge help in building that bone. And then another one, and this is probably a biggie, because this actually starts when you're a teenager or when you're entering puberty. It helps to balance estrogen. And so just to kind of give you a understanding, the first 14 days of your menstrual cycle, your body is making tissue. It's estrogen is the proliferative hormone. It's making tissue in preparation for ovulation and conception, right? And then the last 14 days of your menstrual cycle, your progesterone is at its highest level, where it's thickening and making that uterine wall sticky, so that way your body, or that baby, can implant on that uterine wall. Now, of course, if you haven't had, if pregnancy didn't happen, then about that 28th day, your progesterone levels will plummet, and then facilitating a cycle. And then you start the estrogen proliferative hormone, creating the tissue all over again. And so that, hence the cycle. So you can actually be estrogen dominant even as a teenager, because progesterone levels fall 120 times faster than estrogen, right? And so if you're already having PMS symptoms as a young teenager, then chances are you probably could benefit from a little progesterone, because all that's going to do is increase. It's going to get worse year after year after year, because progesterone levels are going to continue to fall. So so if you think about it this way, as estrogen is the gas pedal to your car, like it's ready, it's going, but progesterone actually is like calm down, estrogen. Let's have a nice little balance. There's a ebb and a flow to the body, and where you want to make, I want to break. So and so if you've ever had, maybe you've heard your doctor say you have endometriosis or uterine fibroids or fibrocystic breast disease or ovarian cysts, things of this nature, just kind of have a little ticker in your brain going, estrogen is making tissue. I wonder if maybe I might need a little bit of bioidentical progesterone. And I say bioidentical for a specific reason, because there are synthetic progesterones out there, and many women, including teenagers, are exposed to this at the forefront when they're talking to their provider, in the form of birth control pills or Depo-Provera or some of these other synthetic progesterones, right? And the reason why you're hearing that message so loud in your ears about these kinds of hormones is because that's what the doctors know. We did not, and I can attest, I did not learn about bioidentical hormones or thyroid or any of this in my pharmacology classes in college. And I can tell you right now, our providers here never learned it in medical school, even though they went to prestigious medical schools. So, matter of fact, our pharmacology was based on the drugs that pharmaceutical companies are making, and making sure that we don't cross interact and have all these negative side effects and, negative impact on someone's health. Whereas when you're dealing with bioidentical, it's so much safer, because all you're doing is yourself, identical. It's matching what your body is already making. So your body, when you take it, it's like it doesn't know any difference. All it knows is that it's getting a little bit more of a supplement to help you with your symptoms and help you with how your cells are functioning. So I wanted to make that very clear, because you'll hear progestin, and you might think progesterone, but I want you to think, all right, that's kind of like an apple is to apple flavored candy. They have the same name in them, and they may have the same taste, but they're not the same. So I wanted to make sure I brought home that point for you. So that way, when you're talking to your provider, and again, when you're talking with them, understand with a little bit of compassion that their knowledge base it doesn't go integrative or holistic or alternative. They don't understand what that looks like, because they have been, I'm going to say the word, because I can say I was propagandized or indoctrinated to actually only look at health in terms of drugs and pharmaceutical companies, and not treating lifestyle, but actually treating the effects of one's lifestyle by giving them drugs to help mitigate the effects, rather than taking care of the root cause. And again, ICU medicine, you don't look at the root cause, you just look at the crisis mode, right? And so again, I want to help educate y'all on the back end to help y'all make decisions as y'all go forward. All right, so another one that I hear, actually I don't hear, but the wellness consultant here, is that if you have breast cancer and it runs in your family, you should never be on hormones. And obviously there's always going to be a right perspective, as with anything that one does, is you have to look at the antecedents, everything that has led you up until this point, to be able to give you the recommendations that are right for you right now. And then as your body gets healthier and gets stronger, and the function of your cells gets stronger, then your overall health is going to improve to where maybe maybe something can be implemented to help you further your health that may have not been the right thing at that right time, or maybe it was the right thing but at the wrong time. So again, I want you to say that at the Wellness Center, all of our providers are looking at your history. Matter of fact, they spend about an hour and plus talking to you, trying to understand what has brought your health into this point, to be able to help pivot that regimen or whatever that looks like specifically for you. So it's all very targeted. So they'll obviously weigh in anything that has to do with cancer, but it's very personal to me, because I have family members that have a history of cancer, and or friends that have had a history of cancer. I probably should say friends. And so in my old way of thinking. I was like, no, I mean, it's too risky. Does the risk really outweigh the benefits of taking hormones, when you've had a history of cancer? And if you're thinking about in terms of the risk, then I have to go back to the truth. All right, where is this originating? And it really started with a Women's Health Initiative study that was back, I believe it's 2002. And so this is, again, my research as I'm trying to unpack some of this as I learn. And they did a study that was using synthetic estrogens and synthetic progesterones and coming away with, oh my goodness, no, we should never give women hormones because there's an increased risk of breast cancer, heart disease, stroke, blood clots. And so, but when you look at the hormones that they're using, progestin, which is, again, not real progesterone that your body even recognizes, and then using pregnant mare urine estrogens, or a hormone that's actually produced from pregnant mare urine that has estrogens that look nothing necessarily like a human estrogen, much less there was a lot, or much more, there was a lot of more estrogens that a horse makes than what is in a human body. So when you look at the fact that they were using those to create a study for humans, it doesn't make sense. It's not the same. So then yeah, of course they're going to have increased risk of cancers because they're putting something in the body that is superfluous to what the body actually needs and actually creates. And the body's like, what is happening here? It doesn't recognize it as the same. So when you use bioidentical hormones, a bioidentical estrogen, bioidentical progesterone, bioidentical testosterone, thyroid, cortisol, whatever that looks like, then your body's actually getting the support that it needs to have healthier cells, to be able to increase your longevity, your health, your bone density, help with heart health, help with metabolism, weight loss, mood, sleep, all of these things that you're probably getting drugs for. You may just need to support your body in a very natural, flowy way that resonates with your body, right? So, and actually natural progesterone, bioidentical progesterone, when they did another study, actually lowers your breast cancer risk. So, because again, it's the brakes to cell proliferation, right? It's helping to stop or put a brake to that proliferation of tissue. And all of us, just so y'all know, and y'all can fact check this, for yourself, but all of us at some level have cancer cells in our bodies. It's just that we have a stronger immune system or whatever your system looks like, to be able to keep all of that at bay. But again, this is why what you do ahead of time is going to help determine what your health looks like in the future. So if you're having a poor diet, which by the way, sugar feeds cancer, and I know I'm kind of taking a rabbit trail, but it's so important that y'all hear this. So sugar feeds cancer. Poor sleep it can impact your brain's ability to function. There's studies out there that show that it can lead to Alzheimer's and some of these other neurodegenerative disorders. So again, everything that you do from a lifestyle matters now. Don't wait until you're 60 and 50 or whatever and actually in crisis mode to fix some of these things. Start taking care of this ahead of time, because honestly, your body is actually stronger now than it will be. Lastly, the other question or concern that some of our wellness consultants here is, my doctor told me never to go on hormones. And when a doctor in a white coat with their medical background says something like this, and you don't really maybe have the bandwidth and the time to sit there and explore and get a second opinion or a third opinion, because all that takes time and setting up appointments and hearing different, and it's just exhausting, right? But just know that if you're staying in the same barrel of looking at providers that are really kind of getting their direction and for treatment based on insurance companies, right, and pharmaceutical companies, you're probably going to get the same answer. So maybe it's time that you start looking in a different barrel and looking at how can I do things differently. And yeah, it might be a little bit of an expense up at the front, but the long-term benefits are going to make that bigger expense up front so pay out like in spades, right? So remember, I mentioned that doctors just have a very limited training. It's not that they're bad. It's just that they have a limitation of knowledge because of the scope in which they learned all of this information and in which they currently practice. So with that, I'll kind of do a little quick recap here. Progesterone still matters. Even though you've cut everything out or you're not cycling, it still matters for your brain health, your bone health, your sleep, your moods. And I'm going to even say outwardly, like, it matters for the relationships with your children. It matters for your teenagers that are coming up and starting to have PMS symptoms. It matters for your marriages, you know, as far as like that relationship with the spouse when maybe your libido might be down and or you're just maybe always angry or moody. And so it adds this nice, calm, stable other where you can actually remember, oh my gosh, this is how I was when I was happily married and 20 and 30 and life was good. And so remember, it's a hormonal deficit, like your hormones are dropping pretty rapidly. And I'm not saying that's the only reason, but bioidentical hormones is a real component to your health, not just physical, but mental, emotional. Okay. Family history of breast cancer doesn't automatically mean that you can't ever go on hormones. So we'll, at the Hotze Health and Wellness Center, our providers will look at all of that, but also understand where you are right now and what is going to be best and optimal for you. And they're not going to tell you, they're just going to make recommendations because it's a partnership. It's a relationship that you have with your provider in which you can share like what's happening with you, and they can take that in and to consider all of that when they're making their recommendations. But it's your health. We just want you to be educated, and we want you to get all the information that you need right out of the gate to be able to make the best decision for yourself. And then, of course, very simplistically, never go on hormones. I just don't buy that. Your women need hormones, men need hormones, children sometimes when they're prepubescent, sometimes they might need hormones, or not prepubescent, let's just say puberty, they might need hormones. So getting ahead of it, the sooner the better, because that's going to help with your health in the future. And by the way, God designed your body to heal. That's how it's wired. It's always trying to find and recalibrate to what's happening in our environment, what's happening in our foods, chemicals, whatever it is. So your body's always trying to restore balance and heal. But sometimes it just needs a little help. And that's why we're here. So I want to encourage you. I'm not seeing any questions right now in the chat. And that could be because we were had a little technical difficulty. But I hope that when you hear this message, if you do have questions based on anything that I've said, or maybe it's tickling a little bit of a thought, that I really want to find out more about this, please, it's just a conversation. It's just a talk, and we're here to listen. Call one of our wellness consultants at 281-698-8698. That's 281-698-8698. And actually speak with one of them, and that's why they're here. They're here to listen and to be able to tell you how we might be able to serve you and help you get your life back. And then also there's, I believe, a link for Calendly. I can't say that very well, but where you can actually schedule a time too, if you prefer using the technology rather than calling. But in any case, you can also go to www.hotzehwc.com. So that's HOTZEHWC.com, and there's actually a symptom checker that if you just want to see for yourself where you might land as far as like your hormones, there's a symptom checker that you can do and just test yourself. And then it has a link to also scheduling a complimentary consultation if you're like, okay, I need some help here. So I just wanted to thank you all for listening and just listening and allowing us to in some way share our heart and our mission and our passion to help you get your life back, feeling enthusiastic and vitality and enjoyment of life and your children and your relationships and work. Just getting your life back so that way you can go do what you were meant and designed to do. Thank you all.